YouTube family, it's the Fat Medical Student. I'm here today to talk about the JP drain. Now, a JP drain stands for Jackson Pratt drain. It is a drain that we use in most surgeries, and it has so many uses and it's so good. It's a window to the wound. So it allows you to see exactly what's going on, and it's often the first sign of an infection. So it allows you to see what's draining from your surgical site. But also it takes out excess fluids, and it's not good for those excess fluids to just sit there. It causes swelling and infection, so it's better out than in. So this is my JP drain. I only have one, but it is normal to have 2, 3, 4, 5, 6. But I have this JP drain because I just had the roux-en-y gastric bypass. So, but people have the JP drain because they have breast cancer, breast surgery, or any kind of skin flap surgery. Some people have them on their spine. So it is normal to have a JP drain. But today I'm going to try to take care of my JP drain. So you see it's all wrapped up. It's all tied up and everything like that. And here's my JP drain with a little bit of fluid coming out of it. Alright, so I've washed my hands with Dial soap, and I have Purelled as well. So now I'm just going to put on some surgical gloves, and although I am at home, see the Jackie house, this is my brother's stuff on the floor. My brother's here taking care of me after my surgery. I'm putting on some nitrile gloves, because you don't want to get your drain or your stomach infected, obviously. So, and I don't want to get an infection. So, I'm going to unwrap the bandages from the JP drain. And we'll start all over again. So, sorry. It's always a hard part. It's taking off the old bandages. So like I said, I had the roux-en-y gastric bypass. I had it laparoscopically done. So so I have 5 little holes in my stomach. They say the holes are the size of a pea. Oh, I can't get this off. I just have to pull this off this way. Sorry, YouTube family. The fun of technology is live. And you can see that on the bandages there's and junk from the bandages.
Good.
So I'm going to throw that in the trash. And so now that was dirty. I'm going to change my gloves. So yeah, I say dirty to dirty, clean to clean. So now these gloves will be my clean gloves. You don't have to change your gloves 8 times in the middle of changing your drain, but my nerves are bad. I don't want to get this infected, so that's what we're going to do. So now I have on clean gloves, and you can see that the drain is literally stitched to the inside of my stomach. There are a couple of stitches, so 1 or 2 stitches, and the drain is stitched to the inside, and then it comes down this tubing to suction bulb. Okay? Now, what I'm going to use is normal saline. So saline is just literally salt water. Now, you can use soap water, but they really don't recommend for you to use alcohol because, well, most people don't recommend for you to use alcohol because alcohol is just a little bit too strong, and you want to keep the good germs there. But obviously do whatever your surgeon recommends. My surgeon recommended for me to use normal saline. So here's my normal saline. I'm wiping around the wound. Okay. Just to try to get the gook and ook off. Lots of gook and ook on the stomach. Okay, just trying to wipe around the wound. And now your surgical drain, it needs to be stripped or milked. And so you grab the side of the drain that's closest to you. Oops, look at that. I'm literally milking it. I just got a gulp of drain juice on me. Sexy. So you grab the side that's closest to the drain, to you, and you're literally just milking the drain. This is to make sure that there's no clots in your drain. And it's also called stripping. You're just pulling it down. And you're pulling all that stuff into the drain so that you can get all that into the drain so that your drain is nice and clot free. Okay, I'm trying to be fast because I know I'm running out of time. Okay? So then you just open up the top and you have this your little suction ball. You take a container, open it up, in this little sterile container. You're going to want to throw this away. And you flip it over and you empty out your JP drain. Now it's important that turn the top on it and you see how much you have. So since yesterday, about 12 hours, the last 12 hours, I've drained about 15 cc's of fluid, and I'm going to write that down, and then I'm going to flush this out in the toilet. You don't have to save this. And you have to keep the section going in your drain. So I like to do it by pressing in the bottom of the drain like so. But some people squeeze it like that. So you press in the bottom, make the Hershey's Kiss type thing. Close it up. And also you see that the drain has this little loop on it. I put the safety pin in there, and I've been safety pinning it to the inside of my clothes so that I don't have the drain pulling down on me. I've been safety pinning it to the inside of my clothes. So now the drain is being taken care of. All I have to do is package it back up. So I take these drain sponges and you just tear them open like so. And I put about 4 on. You can put as many on or as few on as you like, but I put about 4 on. My stomach is a little bit sore. You see the drain is draining. So the surgical drain, it should be a reddish yellow, they say straw colored liquid, but if it should ever turn milky white, so now I'm going to take my gloves off and take the drain out. But if it should ever turn milky or pussy, then you should immediately call your surgeon, and he'll probably ask you for you to go to the emergency room, because pus is always a sign of an infection. So, you just take this on, like so. I don't want to tape up my other wound, so I'll just take that like that. You got your tape right here. And now I'm just taping it up. If you have any questions about JP drains or the Roux gastric bypass, then please email me at fatmedicalstudent@gmail.com, or you can follow my Twitter at my Twitter is fatmedicalstudent, or send me a YouTube comment. But I just wanted you guys to know that you can take care of your JP drain. Anybody can do it. And I wish you the best. And happy JP draining days. Alright, so we're almost done. One more piece of tape. Ta-da! My JP drain is brand new and happy to go. I just have tape on my hands now. Ta-da! And you can just, so if I wanted to pin this to my clothes, I could pin this to my bra. The only thing is that you just don't want to take it off and take your JP drain off with it. And so there, it's just dangling away and it's clean to go. But if you have any questions, then give me a holler. But I hope it wasn't too frantic. This is my second time doing it today. My last video was too long, so I'm trying to do it faster. But alright, talk to you later. Bye.